You have tried everything, and it's becoming extremely frustrating to wake up and have pain every single day. Now, for most people that suffer from plantar fasciitis, Achilles tendonitis, or any other tendonitis in the foot, conservative measures work and most people get better. But if you're continuing to have pain months after months after months of treatment, of doing things like anti-inflammatories, cortisone injections, orthotics, night splints, physical therapy, stretching, shoe changes, and you're still not getting the results that you need, you may have gone into a chronic stage of the disease. Now, this is not extremely common, but it can happen. When the disease becomes chronic, it essentially loses its ability to heal itself. It's no longer going through the appropriate inflammatory stages that allow that tissue to repair and regenerate. Now, you're not helpless. This does not mean that you have to live with the pain forever. It just means we need to try some more advanced treatments. Now, for some people, being quite frank and honest, surgery is your best option. This isn't always the case, and it really depends on your pathology, but it needs to be discussed with the doctor if this is something that is needed. Fortunately, there are additional options. My most common treatment that I use in the office is shockwave therapy. So shockwave therapy is a non-invasive treatment that is done right in the office, where it actually breaks down that scar tissue, but it also is promoting an increased blood supply to that injured tissue, and that really allows it to once again have the nutrients that it needs to go through that repair process. The amazing benefit of this treatment is that we don't have to put you on any major limitations. That means no boot, no crutches, and you can stay relatively active. Now, if you're an athlete or a runner and you tend to have a higher activity level, I may put some limitations on your exercise, but we usually can create a program that keeps you relatively active and safe during this treatment. The treatment is only 5 weeks, which means it is repetitive. You do have to come back to the office multiple times for that treatment. But most people are starting to notice results 6 weeks after treatment, though it can take up to 3 months for that tissue to completely go through that healing process. Another conservative or option for you would be amnion injections, which this is newer technology. It's not quite like a stem cell, but it is actually tissue collected from donated placenta. These are full-term pregnancies and fully consented donations, which then goes through a process that we then make it into an injectable form. Once that is injected, it actually fills that tissue or that damaged tissue with a lot of regeneration cells like mesenchymal cells or growth cells that allows that tissue then to repair. During this procedure, once again, it's done right in the office, we do damage that tissue during that injection, which means we do need to immobilize you or put you in a boot for about 4 weeks after treatment. At 4 weeks, a lot of people are noticing some results. They may not be 100%, but they definitely are feeling significantly better. There are a few people who do need that second injection to really get them over the top, feeling fantastic. So if you are just feeling defeated and getting really frustrated with all of this treatment without great results, it's time that we kind of discuss these alternative or more advanced treatments, because it is likely that you have entered into this chronic state and it's just simply not going to respond to these more conservative treatments that have been tried. So thank you so much for choosing Third Coast Foot and Ankle. We will continue to walk you through all of these options. Everybody is different, and so everybody kind of needs something a little bit different when we get here, but we will get you to that pain-free state.